Hi, my name is Morgan Boulware, and I'm a doctor of physical therapy and a board-certified orthopedic clinical specialist for Benchmark Physical Therapy. I just wanted to share with you a high-intensity interval training program to help you improve your aerobic exercise. This will help reduce the risk of cardiovascular illness, stroke, help with weight loss, and decrease the risk for insulin resistance. It is appropriate for a multitude of ages and abilities because you will use a scale called the Rating of Perceived Exertion. What this is a scale from 0 to 10, where 0 is extremely easy and 10 is very, very severely difficult. When you're doing this program, I'd like for you to try to stay between a 6 and a 7 on this perceived exertion scale if you're a beginner. Feel free to push the limits a little bit more if you're already an experienced, active person. Please keep in mind as you're selecting what intervals to use for your training program, if you're resting for under 2 minutes, then take a passive rest. This will allow some muscle recovery and improve your function for your next bout of exercise. If you're going to rest for 3 to 4 minutes or even more, then I recommend you take an active approach to your rest and continue to walk or do something that allows you to continue moving while still maintaining a slightly elevated heart rate. For each of the following exercises, I will show you a couple reps of me performing the exercise and then a couple reps of the modified version. Feel free to select whichever one best fits your athletic abilities. I recommend that you do an active warm-up for 5 to 10 minutes prior to beginning this exercise session. You can do this by walking, cycling, stair climbing, or many other activities around your house. Our first exercise will be to elevate our heart rates and get our whole bodies moving. It's a jumping jack. You can modify this and make it a low impact exercise by stepping as you move your arms. The next exercise we will perform will work on our chest and our arms. This will be where a yoga mat or a towel is helpful. We're going to do a push-up. If that's too challenging for you, you can modify it by going to your knees. If that's still too challenging, feel free to use a countertop or armrests on a sturdy chair. The next exercise we will perform will work more on our core. You'll lay on your back with your knees bent. And what we're going to do is a sit-up. You're going to engage your abdominal muscles and lift just until your shoulder blades clear the floor. If that's too challenging for you, practice just activating those muscles. Our next exercise will be a squat. You'll stand with your feet about hip width apart. Tighten your core, send your hips back, and keep your chest lifted. If that's too challenging for you, feel free to grab your chair again. You can use this as a depth gauge. Or you can practice sitting and standing. Try to use your hands as little as possible so that you can progress to a freestanding squat. We're going to use the chair again to work our arms. So what you'll do is put your feet out in front of you, and we're going to do tricep dips. If that's too challenging for you, feel free to just hold this position. And you'll still get an effective workout. Our next exercise, we're going to go back to our legs. We're going to do a forward lunge. As you do this, alternate which leg goes down. If that's too challenging for you, feel free to use a chair or a countertop. Step forward, do a mini lunge, and then use your arm to help you press back up. next exercise, we'll go back to our mat. We're going to do a plank. So you want your hands right under your shoulders, going up on your toes, keeping your body in a nice straight line. You could also do this on your elbows. Or on your knees with your arms in either position. That's going to work our core, our shoulder stabilizers, and many other muscles. The next exercise, we're going to go into a lateral lunge. This is again going to work our legs and our hips. Step and lunge. Step and lunge. You can use your chair or sturdy countertop again. Holding on for balance. This final exercise is another variation of a plank. This is going to combine a side plank with a clamshell. You'll go up into a side plank and then lift the top knee without letting your pelvis rotate and back down. Be sure to do both sides on this one. Thank you for allowing me to teach you a few exercises and run you through the framework of a HIIT program. Please repeat this program 2 to 3 times to achieve the recommended amount of 30 minutes of exercise most days out of the week. Be sure to take a rest day between if this is your first time doing a program like this. I recommend that you perform 30-second bouts of each of the exercises we just reviewed, followed by a 10 to 30-second rest. If you're going to rest longer, remember to use the guidelines discussed at the beginning of this video. We here at Benchmark Physical Therapy realize that we are living in unprecedented times right now. If you would like more personalized advice or have a suggestion for a topic for us to cover in the future, please feel free to reach out.